Introduction, I guess. So what I'm going to do today is sort of just take you through some of the basics for the mental health support teams that NHS England have invited both Berkshire West and Berkshire East. I think we've got GPs from both areas in the room today. I'm going to be focusing on Berkshire West, so apologies now, but I'm sure I can work with my colleague Jeanette on getting Berkshire East information specifically to you. But this is talking about where we are, at least as a concept, and then hopefully you can drill down to the detail in time. So, in a sense, what is it? What's the model of delivery at least going on in Berkshire West? I think they're following some similar concepts in Berkshire East. Some timeframes to that, and then what's on offer? What's really going to happen? So, the mental health support teams was coming out of the green paper that was produced back in 2018, if I remember rightly. That was in sort of challenging the system, CCGs, local authorities, primary care, everybody to think differently about the support we can do as early as possible for children and young people who are showing increasing signs of emotional distress, leading on to mental health conditions. Core elements that were talked about and then have subsequently taken root in the mental health support teams is effectively two key things I'm going to talk about today. First of all is creating a point of contact or a senior leadership role within our schools. That's all primary and secondary and colleges. That's what they want. Similar, but not the same, it's like the safeguarding role. Any of you that are governors in schools or have interactions with schools know that there's a real sort of focus on safeguarding, making sure there's a real key point of contact of how they do that. Similar for mental health they want. And then the other thing is setting up a new service called mental health support teams that will work across and around schools and colleges. So they were looking for somebody from within the school structure, so I think it's really important eventually, hopefully, within you as a GP lead will know within your kind of classical geographical patch who these people might end up being, particularly your secondary schools, I would suggest. That from that you have somebody from within the senior leadership structure of the school. So we're having people like assistant head teachers, deputy head teachers, Senkos, those kind of roles are being put forward as the person that will oversee the school's approach to mental health. So you can imagine a school of 200, quite a small school, that's a very different challenge to a school of 1,800 to 2,000 secondary school children. So they're going to have different approaches, but it's within that senior leadership structure. They would be the strategic lead, the person that identifies how the school are going to approach all the different variations of need that they have within their school population. They wouldn't necessarily be working with every individual child, that would be ridiculous, but they're taking that strategic overview, making sure that the range of provision and approach is meeting the needs of their school population. So obviously it's going to be, these people will need support and training. When people go through their teacher training, this is a far, far away from actually what they get told about or taught about. So we've realised we've got to put a lot of time and effort into giving those people as much information, knowledge and confidence to be able to deliver on this role. And then they become the key link for us into our service provision for. So the mental health support teams are newly funded NHS teams of staff that will provide direct interventions to children and young people with mild to moderate sort of needs. So the kind of things we're talking about there would be anxiety, low mood, early signs of depression, emerging conduct disorder, and then we're starting to think about how that would look at in terms of the moderate to complex, because actually there's always that sort of thing about whether they fit within the threshold for going into a specialist CAM service, or whether they're involved in a crisis. How do we work alongside those children and young people? That team would ensure that the whole, what we call the whole school approach, which could be policy, peer support, PHSE, how people do their delivery of pastoral care in the school, through to the direct intervention with the child, group work or one-to-one, how that's getting improved through the school senior leadership. And then, for us importantly, it's got to fit within the wider offer of our specialist CAMs and other services that support children with these kind of needs. So ours is a partnership approach. We have a range of people involved, as you can see from the logos. We, as Berkshire West, sit across 3 local authorities. Berkshire East similarly sits across 3 local authorities. Actually, we're not as coterminous as like an Oxford or other areas. So we work very hard with our 3 local authorities who, I'll be able to explain, is a key partner for us. And then obviously we're working very much with our specialist CAMS provider, Berkshire Healthcare Foundation Trust. So this is the simplest way of describing Berkshire West's team. So we have invested through our local authorities inside our educational psychology services to lead these teams. The key reason for that for us is that they, from a traditional position, have been going in and out of schools on a daily, regular basis, more than any other professional, talking about the kind of children that we have concerns about. So in dialogue with our partners, we talked about where's the best place to sort of push forward this agenda. So we have invested in having a senior educational psychologist being the senior leadership within that team. And that person will be working alongside 2 other senior posts. So we have partnered with BHFT to give us a senior CAMS practitioner who will be sitting into that team, and a primary mental health worker, or PMHW. Then the core bit that actually is consistent across every single programme in the country is that everybody's getting this new role called an education mental health worker, or practitioner, that they will be 4 of them in our team who are currently, they'll go through their first year of employment with us. They go to for us it's Reading University, to complete a very evidence-based course, primarily helping them to deliver some of the interventions that I'll mention soon, in addition to actually knowing how to work within a school or community context. And then we also have invested in them having an outreach worker to try and do some of that work about trying to get to some of the more difficult to engage children, young people and families. So it will be a multidisciplinary team, and effectively they will be bringing together the following components. So each of our areas eventually will have something called a multi-agency triage. So for those of you that have been in West Berkshire GPs for some time, you've known about the Emotional Health Academy, and that's been running a triage system for a number of years where you would often you'd bring children and young people of concern. GPs have been referring children in there for some time, and that as a triage sit there with multi-professional groups from the voluntary sector, local authority, health, and say, how can we meet the need of this child? And they put a package of care around that child. The second thing that they're doing is that regularly our senior leadership team will be working with a senior lead in the school to run surgeries. And that's where those schools will bring children of concern or groups of children of concern and talk about how they can meet those needs. And it could be about a first response within the school that changes the way they're delivering their pastoral care, or a particular intervention or an approach that they can take. It might be that actually the MHST could deliver a particular intervention or approach. It might be that actually they need to refer on recommendation into something like the Andy Clinic. Or even more importantly, it might be that they need to actually go into the specialist CAM service. It's about trying to navigate what's the best option for that child. And the school are trying to be encouraged to be proactive about trying to find those children that actually are emerging needs rather than waiting for it to hit a crisis point. The next bit is that they will be trained and be able to deliver a range of interventions. So the kind of things that they're being asked to do is things like behaviour activation, exposure, therapy, worry or lifestyle management courses, stuff that's looking at that low-level regular intervention that actually are trying to turn the curve for children and young people's lives before it hits into that kind of crisis or needing to go up into specialist CAMs. The conduct disorder, they'll be working with parenting groups, which is often seen as the evidence-based approach, trying to help families cope with the approach around managing behaviour rather than putting it as a diagnosis issue. And then what we're also exploring is how some of our senior leads can actually work with some of the more risky families, the families that have more risk factors around them, be it because of a housing crisis, or it could be to do with siblings, it could be a range of issues that are escalating within that family's situation. And then obviously we've got the importance of providing the appropriate support and supervision to the team. So in Berkshire West, our model is that we take a local authority being that blue line, we would assume that we would probably need with each Reading, West Berkshire and Wokingham 3 mental health support teams to meet the full coverage of that service. So it's about 8,000 pupils per team. We have about 26 to 28,000 pupils in each of our 3 local authorities. So if we had our way, we'd have 9 teams across the whole of our Berkshire West patch. I think Berkshire East would probably be around 8 or 9 themselves as well. In each of those teams, which would be the small green thing, you'd be running your mental health surgeries, and then entirely dedicated to the local authority in Hull, the blue box having an emotional health triage, where people can identify, they can self-refer, GPs can refer, other professionals can refer. So the school can identify as well as the wider community. And in that, you've got the MHST providing that direct support in and out of the triage and back to the school base. So for Reading children and young people, so this is probably the bit that's probably a bit too specific for some of you, but we do, this will get circulated. So there is a referral process that's open for every child, at the moment, and they can go into the triage and get support. Where we are, though, is that we've only been given the money to set up 3 teams within Berkshire West at the moment. So one of those teams is in Reading, one of those teams is in West Berkshire, and they've gone live literally this month. So those are linked to particular schools. And so, for example, these are the schools that Reading have an MHST presence in right now, which is 1/3 of the borough. So I don't want to overcomplicate it for you guys, because I don't feel you need to say, so what school are they going to, and do I need to refer? No, the critical bit for us is to say, send it into triage, and then they will sort out behind the scenes how that child can access the right support. But hopefully, over the next 5 to 10 years, every child that you see of school age will have access to an MHST, so you don't have to worry about whether they get that additional support or not. So that's the Reading details. They're the Reading schools, and from their perspective, Reading is quite a small but quite tightly packed, urban area. 3 teams. They've started in what they would geographically call the west of Reading. So from the town centre up towards Calcutta, effectively, for those that know the patch. West Berkshire have a long-standing arrangement of open referral to their emotional health triage. All the details are there. You can phone, email the referral form, which is downloadable, or you can do an online referral form now. So all of those options are open to you as colleagues, or you can talk to families about self-referring as well, and they can use that process themselves. So a lot more schools in West Berkshire, because there's some that are really tiny. They're like 200, 150 pupils, but you can see there's 3 quite big secondary schools there. So mainly that's in the central part of West Berkshire Local Authority, but they have got some stuff up in this area as well. And it's a bit harder geographically because it's such a big urban rural area that West Berkshire is. So Wokingham is our third. So we got, in January 2019, the opportunity to set up 2 what they call trailblazer sites. So we have done that in Reading and West Berkshire. And then we were fortunate enough to be awarded a 3rd team that started in September 19 to be trained. They'll be going live in September 2020 this year. These are the schools that team will be working in. It's not easy to put on a map because they're scattered across the authority. And my recommendation is, while we're setting up, like you do now, if you're a Wokingham GP, just talk to the common point of entry in BHFT about that child's needs, and then in time they will have their own triage and set of arrangements that you can connect with from next autumn onwards. So in summary, not too bad, we're looking to change schools and the way that they approach the emerging and escalating issue of emotional distress and mental health. It's the place that children go to more than any others outside of home. It's the place that the professionals that will end up knowing their children best. And I know that in your contact with families, it's often a conversational issue around what's the school doing, how are they helping and supporting you. And we can only encourage you to continue that dialogue with the family, who I know at times don't always present the best picture of what schools are or aren't doing, but we try hard to try and get schools in a place where they're meeting and identifying need rather than seeking some kind of medical diagnosis. They've got to try and help those schools navigate the mental health system for that child so they can get the best support as quickly as possible. We want to try and get system-wide thinking going, that we will try and provide support regardless of where the child sits in the system. Yeah? So they could be open to CAMS or going through a crisis, but there's no reason why they couldn't be getting the kind of support a mental health support team could do alongside the risk support they're getting from a specialist CAM service. And then we want to increase and up the level of evidence-based interventions that are available when the child first and the family open up to say, we have needs. Yeah? So that there are that desire to train more people, recruit more people, which is trouble within this sector, so that they're ready and able to deliver more interventions that we believe, with the right evidence base behind them, can actually change that child's opportunities and child life chances and get them back to where they would like to be. Right, that's me. Any questions? Look.
Hello. I seem to see